I'm Jane Hay. I work here at the Great Western Hospital as an advanced physiotherapy practitioner specialising in spines. This session is aimed at people with neck pain. It's a common problem and can occur at any age and for many different reasons. Therefore, the advice I'm giving you today is very general, but some of it you may already know, but hopefully there will be a few gems that you'll find helpful. I'm planning to cover common symptoms, some basic anatomy looking at the structure of the neck, common causes of neck pain, how you can help yourself, a little bit about why neck pain can persist and become chronic, how we diagnose neck pain, and then treatments for neck, including the all-important neck exercises. Okay, so the common symptoms that can go with neck pain are pain radiating into the shoulders, down to the shoulder blades, perhaps down into the arms, and even up into the head as well. The muscles may feel tight and tender in this area in particular. Stiffness makes it difficult to turn the head, and you'll notice this when you're doing things like reversing the car. Numbness or tingling in the hands and arms. People often describe clicking or grating noises in the neck. Muscle spasms can kick in, and occasionally it can make you feel dizzy as well. And of course there's the tiredness and the way it affects your mood too. So if we look at the structure of the neck consists of the first 7 vertebrae on the spine. This is a life-size model. What you can see here are the bones acting as building blocks on top of each other. The spinal cord goes down the centre of the bones and is well protected in there. You have the discs sitting at the front of the spine here, shown by these sort of little clear rubber areas. You can see that they're smaller, much smaller than down here in the lumbar spine, but they act as spacers, so they're keeping the joints apart. At the back here you can see the bony spikes, and they're designed for muscle attachment, and they're the bits that you can feel if you can run your finger down the back of your neck. Either side of the neck there at the back is a joint on each side at each level, and they're called the facet joints, and they guide the movement. They're designed to move a lot, and they are prone to wear and tear like all our other joints. And in between each of those joints you'll see a little nerve, this yellow part, that's the nerve emerging at each level. Each nerve goes to a different area, either up into the head, around the neck, or even down into the arm. And obviously the other side is doing the same thing there. And these nerves are emerging through small holes on the side of the spine, and you can get some irritation at this point. So if we move on to the causes of neck pain, there's lots of structures that you've seen that can cause pain. The most common one is the postural pain, and this is where the muscles and the ligaments become sore because they're working too hard. The head is heavy and it must be loaded directly on top of the bones in the neck. If you were to hold your head on one side all day, you'd expect it to become sore. But many of us allow our chin to poke forwards. This is the most common thing. So if the head is poking forwards, then the weight of the head, which is as heavy as a medicine ball, isn't stacked on the bones of the neck. And so the muscles have to work far too hard to hold it there. So we need to be particularly careful about the postures that we adopt during the day, whether we're eating or driving or working at a desk. We need to be careful. Often the upper back becomes stiff, and if that is stiff, then it's really hard to get that head loaded back over the spine. So it may be that we have to do some loosening up in order to allow that postural correction. Second most common cause is arthritis, which has got lots of different names. Spondylosis, wear and tear, age-related changes. But basically, it's a normal aging process. It's like going grey or bald. But as the changes happen in the discs and the facet joints, they can give rise to pain. So like any other joint, the trick is to use heat or ice and painkillers if necessary and keep it moving. We'll be going through some specific neck exercises that will help the pain arising from arthritis.
So another reason for neck pain that we see quite a lot of is trauma, so such as a whiplash type injury, where the soft tissues are sprained and strained, and they can take quite a few months to settle, but they do get better. Tension and stress is nearly always a part of neck problems. Necks are known as emotional joints, and when we get tense, it's very often these muscles that we grip with, and they're attached to the joints in our neck, so there's this compressive effect down on the joints and the discs, and that can make them sore. So that's why we try to recommend heat and relaxation so that the muscles can be softer. And you've probably noticed you feel better after a warm bath, shower, or using a wheat bag, because it relaxes the muscles and that eases the pain. The discs can give rise to problems. They act as shock absorbers, and when we're young they're like tubes of toothpaste, tough on the outside and jellyish in the centre. But as we get older, they become less hydrated and they can become a bit of a problem then. So how can you help yourself? That's what people want to know. Most episodes of neck pain do get better, and with a few days of painkillers and relative rest, things resolve. But yours obviously hasn't, and that's why you're listening to this talk. But just because it's persisted, it doesn't mean to say it's serious. It just means that you haven't changed what is causing the problem that's caused you to stiffen up or change your posture or tense the muscles. And so you need to address these problems. So painkillers are quite helpful. A simple paracetamol can be really quite effective if taken regularly and before the pain gets too bad. They have minimal side effects, and a full dose of 8 a day is okay. If you're worried, then obviously talk to your pharmacist or doctor. Anti-inflammatories such as ibuprofen can be effective as a short course for a few days, but if you require them for longer, you should really be chatting through with your GP, because they can cause some problems. Anti-inflammatory creams or gels can also be effective, sort of rubbing it around the area. And there are stronger tablets if necessary, but the higher you go up the analgesic ladders, then the more often you're more likely to get side effects. What is important though is that you are comfortable enough to move and do the exercises. If you are only okay if you keep your head still, then that isn't okay. You obviously need painkillers so that you can start to move your head, you can start to relax your muscles, and then hopefully we help to break this vicious cycle that really isn't helpful. So exercise. A short period of rest can be initially helpful, but to prevent muscles weakening and joints stiffening up, we have to get going as soon as possible. So gentle stretches can help ease neck pain and stiffness. You need to start gently and repeat them a few times a day, every day. They do get easier and more comfortable, but you do need to persevere. General exercise is helpful, so walking, yoga, Pilates, it'll all be helpful to your neck as well as the rest of your body, because if the rest of your spine is supple, it takes the strain off your neck. Research shows that the best treatment for arthritis is exercise. We'll be going through some specific neck exercises later. We've mentioned that it's common to hold tension in our neck muscles, and then this makes them sore. So it's logical that relaxing the muscles will have a beneficial effect on your neck pain. There are all types of apps and CDs and different techniques to help with relaxation, but it might be just as simple as taking time, even just 10 minutes, to make yourself comfortable, notice the tension that you're holding in your neck muscles, and use conscious breathing to help relax and let that tension go out of the muscle. It takes a bit of practice, but it can be very effective. You just have to find something that works for you. So heat or ice? Well, we tend to advise ice on a new injury or episode of pain and heat on an old, grumpy, achy one. But it's worth trying both and see what works for you. If your neck feels hot and swollen, then ice will probably work best. This is a bag that will go in a freezer, and then you can wrap it in a towel and pop it over your neck. Heat-wise, there's various different gadgets out there. My favourite one is the wheat bag, which is a little bit longer than that and contains grains that you pop in the microwave. Very easy to use, and you can reuse it. You just pop it round your neck again, and I think the weight of it helps to pull your shoulders down away from the ears and give those muscles a gentle stretch. Massage is helpful too. It's a natural reaction to really rub into a sore area, and if perhaps using aromatherapy oils or liniments such as deep heat or biofreeze can be useful. Again, start gently, because it can be quite painful if you're going too hard and fast. Once you begin to get the muscles to relax and soften, you'll notice that the sore points become more specific and more localized. These are trigger points. Acupuncture is useful on these, or acupressure. So acupressure is just where you put some pressure on that specific spot and you hold it down, but it does need up to about 90 seconds. It does take a bit of time, and you'll feel the pain dissipate. You'll feel it just easing off and the muscle relaxing, and then you know that's the point at which you can take your finger away and then go into the gentle stretch, and that can be really quite effective. So let's move on to posture. Pain and stiffness can be caused by a number of factors here. So poor sitting or standing postures at work or at home, staying in the same position for too long, such as long car journeys, or perhaps your bed or pillow is not right, it's too hard or it's too soft. Almost everything we do in the day and night can cause symptoms. So let's start by thinking about what you do most of and get that right. Or you could start by tackling what causes you most pain. So if we think about sitting, if I turn sideways, how often do we think we see people sitting at this sort of angle? So we need to correct this. The first thing is to put your bottom towards the back of the seat. And then try and load your shoulders back over your hips. And then the head needs to correct backwards as well, so that your head is loaded over your spine, which is loaded over your pelvis. You might find that using a bit more back support is helpful. So perhaps a rolled up towel placed in the small of your back throws you into a more upright position and therefore makes it easier to correct your neck posture. When you're in the car, think about putting your head as close to that headrest as you can so that you know it's in the right position there. When we're thinking about pillows, one pillow is best for most people, but if you're very broad-shouldered you might need two, but it really depends on what position you sleep in. You need to make sure that your neck stays in a neutral line with the rest of your spine. So if you were lying on your back and you had too many pillows, you'd be in this position. If you didn't have enough, you'd be going backwards. And then if you lie on your side and you haven't got enough pillows, you're into this position, or too many, you may be propped up into that position. So you need to get somebody to have a look at you in your most common or favourite sleeping position and just check that that neck is in alignment with the rest of the spine. Pillows need to be hugged into the neck, really, so they fill the space then between your neck and your shoulder. Orthopedic pillows have a roll in the front edge of them, so that gives you more support there. If you're wondering whether that sort of type of pillow might suit you, then try putting a rolled up hand towel in the front edge of the pillowcase so that the support is there, and that will hopefully be comfortable. If it is, then you will probably like an orthopedic pillow. So some people's pain becomes persistent, and that's because the original problem hasn't settled down for one reason or another, and this is what we call the pain cycle. Pain prevents movement, and so the muscles become weaker and the joints stiffer, and then the muscles tire quicker and are more likely to hurt when you do move your neck. And when you're in pain, your instinct is not to move. So over time you start to avoid more and more activities, and then this starts to affect your work, your social life, personal relationships and hobbies. And as you do less things that you enjoy, you start to lose confidence, and this can affect your mood, and you may even start to suffer with anxiety or depression. You'll probably by now find that family members and medical professionals are appearing less helpful or unsympathetic, but that's because they've given you the initial advice and sympathy. You'll be now feeling like even less likely to want to do exercises and doing everyday activities, so you become weaker and stiffer, and you can see how it just goes on and on in a vicious cycle. So you somehow need to try and break this cycle. We've already talked about some of the ways to do this, so get your painkillers right, use heat and ice, think about your posture, start working on your neck exercises, and just try and break that cycle in several different places, and then it can be quite effective. So when all this self-help isn't enough, what can we do to help you? What treatments can we do? So physiotherapy can give you gentle hands-on mobilizations or soft tissue work. We can help boost your exercises along a little bit and encourage you in the right direction and help break that pain cycle so that it's easier for you to get on and help yourself. TENS machines can be helpful. These are small little battery devices that you can stick the pads onto your painful areas and you feel a tingling sensation, and this can be quite effective for some people in blocking out the pain signals that are being transferred up to the brain, so your brain is registering the tingling rather than the pain, and that can help break the cycle and obviously can sometimes allow you to be able to cut back on drugs that are maybe giving you some side effects. We have a system here where we let you borrow one for 2 weeks, and if it works for you, then great, you can go ahead and spend some money on it, but if it doesn't work, obviously you've not lost anything. So let's have a go at some specific neck exercises. Have a go with me as you watch the film here. Just have a go and see how they feel. You'll feel that they may be a little bit difficult to start with, and some movements are harder in some directions than others, but they should get easier as you practice them. Okay, so let's get yourself comfortable. First of all, make sure you're sitting in an upright position, your shoulders are relaxed, and maybe use some lumbar support there. So you're going to start by turning your head to one side. Just go gently to start with. Each movement, each time you repeat it, it can go a little bit further and a little bit further each way. But be careful to only use the amount of effort that's needed to get you to that point. So we don't want a lot of extra muscle work going on there. So don't try too hard. Just gently repeat that movement, and it should go a little bit further and a little bit further each time. And then you're going to do it to the other side, so gently round to the opposite direction, gently round. I find it's easier to do several in one direction and then do the other side because it doesn't make you quite so dizzy at that point. So now we're going to move on to side tilts of the head. So you're just going to drop the head over to one side, just allowing that neck to drop all the way over to the side. Again, each one should go a little bit further. Careful that the opposite shoulder doesn't follow. You want to be able to fix that shoulder down so that you really are getting a bit of a stretch between the ear and the shoulder and the muscles that span that space there. So just slowly over there, dropping it to the side, allowing those muscles to pull out, easing into it each time. So now we're going to look at flexing and extending the neck. So again, make sure you're sitting comfortably, and you're going to drop the head all the way forwards and then going all the way backwards. Go careful on the backwards one. Go with a bit of a chest lift as well, so your chest should lift up and then the head extend over the top. You should feel the stretch going down the back as you let your head go down forwards, and then as you go backwards, obviously it's going to be more at the front. Just be careful you don't feel too dizzy going backwards as well. If you do feel dizzy, just stop at that point and just don't push that one. It's not a movement we do very often, but it's good to practice it, and it's good to get that movement going if we can. So really lifting that chest up as you go backwards. So this is an exercise that's going to loosen up that upper back. As you remember, I said the posture is difficult to correct if your upper back is stiff. So by twisting round and rotating round, you're freeing up that mid-thoracic spine. So you're just going to twist round in the chair, use the chair to give yourself a little bit of an extra pull round, an extra bit of a stretch, and then just get the shoulders twisting right round, almost to 90 degrees to your hips if possible. So this next exercise is one of my favourites, particularly for people that spend a lot of time sitting. So you're just loosening up that upper back again, going backwards. Use a chair that sort of fits in, just stops at about the shoulder blade height. And you're just extending over the back of the chair, using it to pivot over, but you're keeping the chin tucked down as you do that. So your neck is not going backwards. It's your upper back that's doing the movement. So this exercise is one that we call retraction or chin tucks, and it's just trying to get that head to slide backwards over the rest of the spine. We're obviously overcorrecting here in order to try and stretch it. And the hope is then that you then relax back to a more neutral position rather than poking that chin forward. So chucking that chin back in, and you'll probably feel it pull down into the upper back as you do that. So this last exercise is good for loosening the whole of the spine up really. So make sure you're comfortable in a comfortable position. You can use a pillow. Relax your neck and shoulders.
Try not to hold any tension there. And then you're going to drop both knees over to one side, so you're twisting the spine from the bottom upwards. And it just helps to relax and release those trunk muscles. And then hopefully that will then allow the neck to move more freely. So each of these exercises is doing a different movement. So ideally you need to try and do all of them. If one in particular is causing you to discomfort, then leave that one, do all the others first, and then perhaps go back to it and see if it's easier to do once the rest of the neck is freed up. I don't want you to push into pain on any of the exercises. So any hint that pain is coming on, just stop at that point and then relax back. You can nudge into stiffness, because obviously we're trying to loosen things, so you can nudge into stiffness, but it shouldn't be actually painful. So it's not a case of no pain, no gain.
If you have any concerns after doing these exercises, then please do contact us here in the physio department and we can chat things through with you. There are some exceptional circumstances where you should seek urgent medical advice. These are known as red flags, and for the neck it's mainly blackouts, lightheadedness or visual changes when you move your neck, or significant change in your strength or balance in your legs. So thank you for listening. Hope you found it helpful. Good luck with putting the advice and exercises into practice. If you need any further help or advice, please do contact us in the physiotherapy department at the Great Western Hospital.